Thank you. So welcome to this webinar on the introduction to the 1970 British Cohort Study. And thank you for being interested in this data. We're really excited to introduce you to it and hopefully set you off on a path of research using this important data resource. So just a few housekeeping things to start with. We ask that you keep your cameras off and mics muted at all times. We are recording this session and it will be made available on the CLS website in due course. And so for that reason, it just helps with your own privacy and anonymity to keep your cameras off and mics muted. There is a live Q&A session at the end of the presentation, and we invite you to submit your questions via the chat function. Please note your question will be visible to all attendees, and when I'm reading out the question, I won't say your full name, just again to keep your sort of privacy, respect your privacy. But please do use that chat function throughout, so just document the questions as they come to you, and we'll answer those at the end of the session. If you're having any technical issues, please use that email address to raise them. And for our sort of process of developing our training programme, we'd be really grateful for any feedback you have on this session. So there will be a link in the chat towards the end of this event to complete a short survey, and it really will help us develop the resources and improve the offer, the training offer that we have here at CLS. So, okay, that's the sort of business part of things. Let's talk through the plan for today. The first section is about CLS, just a quick overview of the resources that we house and the other opportunities for data use with our cohort studies. Then Vanessa will take you through an overview of the BCS 70, including some examples of previous published research using this resource. We'll identify data and variables by theme, so hopefully picking up on some of the independent and dependent variables of interest to you. And a discussion of the data enhancements and innovations will follow that. I'll take over again for some sort of mapping of the available resources that we have for this data set and also how to access the data. And we'll just briefly give you an overview of the current sweep, which is in the field, so you know what data is coming up. And as I mentioned, there's a Q&A to the live panel, and today our panel of experts include Vanessa Milton, who's a senior researcher here at CLS and study researcher for BCS 70. I'm Morag Henderson. I'm an associate professor in sociology and the principal investigator of Next Steps, another data cohort that we have here. We've got George Plebidis, who is the director of BCS 70, Matt Brown, who's the senior survey manager and has worked on BCS 70 for a number of years. We've also got Andrew Peters, the research data manager, and Sam Parsons, a research fellow, who'll all be able to hopefully use their hive mind to answer the questions that you pose for us today. So I'll move on now and just give you a brief overview of CLS and the other studies that we house here, and then I'll hand over to Vanessa to take you into a bit more detail about the British Cohort Study. So the Centre for Longitudinal Studies is home to 4 national longitudinal cohort studies, which follow the lives of tens of thousands of people. Each of our cohort studies follow large nationally representative groups of people born in a given time period, whether that be a specific week or year, etc. So by collecting information from the same people over time as they live their lives, our studies are a powerful resource for answering important research questions. And we'll give some examples of those later in the session. So here are the 4 cohort studies that we have at CLS. We've got the 1958 National Child Development Study, and they're around 64 now, so we've followed them since birth. The 1970 British Cohort Study, which is obviously our topic of interest today, they're just turning 52 this year. And again, we followed them since birth. There's Next Steps, which are people born in 1989-90, and they're age 32. And unlike the others, they weren't followed since birth, but they were followed since the age of 13, so just as they were entering into secondary school. And then the Millennium Cohort Study, who were born in the year 2001-2 and are around age 21. So obviously, as I've said, the focus today is the British Cohort Study, sometimes known as BCS 70, and this follows the lives of around 17,000 babies born in one particular week in 1970. There are some additional data sources that are affiliated with the BCS, as well as the other cohort studies that we have at CLS. And these are the COVID-19 surveys. So obviously the national trauma, I'd say, that we went through during the global pandemic made an important sort of natural experiment for us to observe and document people's lives and experiences during that quite unique time. So we rallied and pulled together some sort of between sweep surveys that would allow cross-cohort comparison during the COVID pandemic. So the first data collection was in May 2020, the second later that year in the autumn, and then the third in February, March 2021. And what that allows us to do was pick up on people's experiences, their health, wealth, economic situation, mental health at those time points, which would enable us to look at cohort-specific experiences during that time. So that's an additional resource that we have. And for those eagle-eyed amongst you, on the slide where I said we have 4 cohort studies at CLS, there was an asterisk there, and just to say there are some additional CLS affiliated studies that we are involved in the development of, and these include the Early Life Cohort Feasibility Study, which is a 2-year funded project to test the feasibility of a new birth cohort study. There's the Children of the 2020s, which is a cohort developed in collaboration with the Department for Education, and will include babies born from September to November 2021 and aims to recruit over 8,000 families. And then there's the COVID Social Mobility and Opportunity Study, the COSMO study, which is looking at specific experiences of the COVID pandemic for year 11s during 2021, and is funded jointly by the UKRI and researchers from both UCL, CLS and the Sutton Trust working on developing it. So that's the asterisk part. Just to say, with the 4 cohort studies that I've mentioned, there is more information on training and support and some other of the recordings that we've done similar to this one on the other cohort studies on this web page that might be useful to know. And okay, with that said, I'll hand over to Vanessa, who's going to talk you through a lot more of the detail related to the British Cohort Study. So Vanessa.
Okay, thank you, Morag. I'm just going to get my slides up.
Great, we can see your slides, no notes, but we can't see you yet. Yes, there you are. Hi.
Okay, here I am. Okay, thanks, Morag. So I'm now going to give a brief overview of the 1970 birth cohort study. So BCS 70 is a multi-purpose and multidisciplinary study of babies born in 1 week in 1970. And it collects detailed information on a variety of aspects of cohort members' lives, which we'll run through a bit later, but covers basically economic, social and health aspects. The survey began as the British Birth Survey, which aimed to examine social and biological characteristics of the mother in relation to neonatal morbidity. The survey, as Morag said, consists of over 17,000 cohort members born in England, Wales, Scotland, and the birth survey included babies from Northern Ireland, which were not followed up. Also, at ages 5, 10 and 16, the sample was augmented with those who had been born overseas in the relevant week and subsequently moved to Great Britain, and there's around 400 of those. So, as mentioned earlier, the focus was medical, and at each sweep, the scope of the study has broadened. So, in the childhood sweeps, there's also educational, social and physical development. In adulthood, there's transitions into adult life, things like family formation, employment, formation and maintenance of adult identity, And moving forward, there's precursors of beneficial and adverse circumstances in midlife. And if you want to find out more information on the history and what's available, we have two cohort profiles for the BCS70. The first one by Elliott and Shepherd was up to age 34, and a recent updated profile is available of the last three sweep, ages 38, 42 and 46, as well as information on the COVID surveys. So post-birth, there have been 9 sweeps. The childhood sweep interviews were completed by the parents, and at age 10 and 16, information was also gathered from class teachers and head teachers. There was also medical records and examinations in childhood, as well as cognitive tests. The age 16 sweep was the first time the cohort members were interviewed, and at this sweep their participation was quite extensive, covering their lifestyle, attitudes, activities, and included diaries as well. In adulthood, the cohort members were the main focus of the study, although at age 34 there was a sweep including the cohort members' children who took part. At age 42 and 46, the cohort members completed cognitive tests, and the age 46 also included a biomedical survey and also a diet diary. So also a number of measurements and samples have been collected throughout the life course. There are a variety of physical measurements at most sweeps, medical examinations, as I've mentioned, the most comprehensive at ages 10, 16 and 46. A variety of cognitive measures, ability and attainment measures in childhood, as well as basic skills, literacy and numeracy at age 34, and in midlife, looking at cognitive function. At age 46, the cohort members also wore an accelerometer and completed a diet diary, and I'll talk a bit more about that later. Also at age 46, a blood sample was taken to examine biomarkers and also for DNA extraction, and the genetic data is due to be available sometime next year. In addition, consent was sought for linkage to health records from the National Health Service, and also economic records from the Department for Work and Pensions and Her Majesty's Revenue and Customs. As well as the main sweeps, there's also been a few sub-studies. At age 22 and 42 months, the study examined the impact of fetal nutrition on early development, and those invited to take part were 10% of all study members, all twins, triplets, those born after more than 42 weeks of gestation, and those who had particularly low birth weight. And that was ended up with around 2,500 cohort members taking part in that. And they were asked questions about family circumstances, development, as well as a medical examination. There was also an age 7 survey, which was basically a contact exercise trying to locate cohort members who were not followed up at age 5. And 4,750 were located, and just under 2,000 responded to that. At age 21, a 10% representative subsample were given literacy and numeracy skills test and asked about employment, education and training. And a similar study was also conducted in the National Child Development Study at age 23. At age 38, there was a twin study. And again, this was also conducted in the National Child Development Study. So there's quite a lot of synergy between the two studies. And this was to identify zygosity, so basically identical twins. And I'll talk a bit more about that later. So here we have the main sweeps and the number of cohort members who took part in those sweeps. The birth sweep included around 16,500. And by age 16, the response was around 11,600. You'll see that from age 16, there was a gap of 10 years due to lack of government funding. And at age 26, a postal survey was sent to the cohort members with a response rate of around 9,000. And since then, the response rate, although slightly higher at age 30, on the follow-ups every 4 years, has been fairly constant. So I'm now going to show you some examples of research that's been conducted using the BCS70. Over the last 50 years, there's been a massive literature produced, journals, working papers, evidence for public policy. And these examples, they're not necessarily the ones with the highest impact, but just illustrate some of the work that has, and maybe give you some ideas of work that can be done. So as mentioned, the early focus of the BCS70 was medical. The detailed medical information collected in early life has been used for research published in top journals such as The Lancet and the British Medical Journal. This first paper looked at the influence of breastfeeding on bronchitis and admissions to hospital for low respiratory illness and gastroenteritis by age 5. And they found, after controlling for other factors such as maternal smoking, family social status and birth weight, there was no association with respiratory illness. But gastroenteritis admissions was marginally associated with infants not breastfed. Excuse me. So the second paper showed at age 10 that systolic blood pressure was inversely related to birth weight, and also suggested that geographical differences in childhood environment predisposed differences in cardiovascular mortality. So this next paper, published in the field of economics, used data from early life, both parental circumstances and information about the cohort member as a child themselves, to explore intergenerational persistence in income. And they investigated the role of education, ability, non-cognitive skills such as conduct and emotional problems, extroversion, locus of control, self-esteem, and also labour market experience. And they found that these factors account for half of the association between parental income and children's earnings. They also looked at mobility using 2 cohort studies, the BCS70 and, as I've already mentioned, the National Child Development Studies, who were born 12 years earlier. And they found that 80% of the decline in mobility over that time was mainly due to the increased relationship between family income and education and labour market attachment. Many papers have used the BCS70 to look at higher education. The first here investigated the difference in salaries of cohort members attending an elite versus a non-elite university, and the work revealed a hierarchy of university degrees in terms of joining the top 50% of earners once prior socioeconomic and educational factors were accounted for. But also the type of degree was important, such as whether they were studying things like law, economics and management. Another study showed educational inequality widened across 2 cohorts, again the NCDS and the BCS70, and links between educational achievement and parental income and social class strengthened, while ability became a poorer predictor of whether the cohort member got a degree. So the paper behind this headline caused a bit of a media stir quite recently. The work showed that by age 46, midlife multimorbidity was high, around a third, so around about 34%. And the work showed the importance of early life exposures such as increased birth weight, low BMI, high cognitive ability and lower emotional and behavioural problems in childhood and adolescent, which are potentially modifiable, were associated with lower risk of multimorbidity. And finally, as Morag mentioned earlier, there's been, we have information on COVID-19, and here are some of examples of the recent work using the COVID-19 data collected in longitudinal studies, including the BCS70. So by asking the same and similar questions during COVID across a range of cohort studies, and not just those housed here at the Centre for Longitudinal Studies, researchers have been able to look at a variety of topics, including risky behaviours, long COVID, while controlling for rich data collected prior to the pandemic. Also having pre-COVID measures of, for example, mental health and health behaviours. These studies have been able to examine changes and the influence of factors pre-pandemic on diverse areas of people's lives, such as work, sleep, exercise, health and risky behaviours during COVID-19. So this next section of the webinar is designed to give you an overview by some themes and disciplines It's by no means extensive or exhaustive. As you can imagine, across the live course, there's a vast amount of information that's been collected about the cohort members. So, okay, so here are the themes I'm going to run through in a bit more detail. You might consider these to be your main explanatory variable of interest or the main dependent variable of interest. For example, you might want to look at the relationship between mental health and educational attainment, or by family relationships and behaviours and attitudes and so on. These areas of interest should be embedded in the literature. So let's start with family and relationships. So we measure who is in the household at all sweeps, capturing family change and family factors that may influence child development across childhood, including who the cohort member lives with and their relationship to the cohort member. In childhood, we measured whether parents were biological, step or adoptive parents, whether the parents, what were the parents' marital status, and information about partnership formation and dissolution. Mother's pregnancy history, labour and delivery, childcare in the early years, the socio-economic context of the family, family life, and the cohort members' friends and socialising. And these can be used to control for early life experience as well as predictors of change as outcomes themselves, or longitudinally over childhood to investigate change or key timings in a child's development. So I've grouped made some groups in terms of information into the cohort members' partners, family and other related areas. Firstly, there is a partnership histories dataset from age 16 to age 46. There is socio-economic information about the cohort member and their partner, including status, economic activity and employment histories. There's information on cohabiting and non-cohabiting relationships, as well as relationship satisfaction. Throughout the adult life course, there's data on the cohort members' children, the number of children they may have had, whether they're biological, adopted, the parental demands that they faced, and family activities, as well as data in midlife on the cohort members' own children's own socioeconomic status, education, marital status, and fertility. In addition, information on the cohort members' parents' mortality and care provision, and data collected at age 46 on grandchildren. So you can see there's information there on four generations. Also, there's data on support from family and friends and social contact and support in midlife. So moving on to education and cognition, and again, education and cognition earlier in life can be used as controls, predictors, as well as outcomes in early life or later life. So we have parental education for both the mother and partner, the age they left school, and highest education achieved. For the cohort members' education, we've got early years, whether they have any special educational needs, and teachers' assessments also of their abilities, learning problems, and the educational environment which they were taught in. Their study intentions at age 16, as well as their academic, technical and vocational qualifications and training, which is collected throughout adulthood. The study collects the cohort members' partners and also the cohort members' children's highest education as well. So this table here groups the cognitive tests that have been measured in the BCS 70 by the main skill measured. So as I mentioned, at age 22 and 42, a subsample of cohort members' parents were identified the cohort members' developmental milestones, so things like gross and fine locomotor skills, speech and language, and drawing. And then throughout childhood, the cohort members have completed measures of verbal skills, including reading, vocabulary, comprehension, and verbal knowledge. Other cognitive domains tested include verbal and non-verbal reasoning, mathematics and numeracy, visual and spatial processing, and short-term memory. In midlife, there are measures more to do with function, cognitive function, so executive function, memory and processing speed have been tested. And some tests have also been measured at more than one time point. So, for example, the British Ability Scales Matrices test and the Edinburgh Reading test were measured at age 10 and 16. and at age 16 the cohort members completed a vocabulary test, which they also completed again in midlife. So there are other cognitive assessments in the BCS-70. As I've mentioned already, literacy and numeracy skills, a subsample at age 21 completed these, and a repeat of some of the same questions at age 34, as well as other questions, were completed. And again, there were similar questions have also been asked in the National Child Development Study. When the cohort members were age 34, as I mentioned, there was a parent and child study, and this included the completion of age-appropriate British ability scales, specifically on measures of verbal and numerical skills. So the BCS-70 also, as I've mentioned, has a very strong focus on physical health. The birth survey was completed by the midwife who was present at the birth of the cohort member. So there's extensive and professional information on antenatal care, pregnancy, labour, infant health and obstetric history. In childhood, there's information on types of immunisations, vaccinations and use of health services has been collected. And in both child and adulthood, there's information on accidents, hospitals, admissions and medication. In addition to that, this is supplemented by linked administrative health data, which is also available, and there are health records in England and Scotland, and there are also records of deaths of cohort members from 1970 to 2015, and the death records will be updated and be made available in due course. So throughout, measurements and samples have been collected. So height and weight has been collected at most sweeps, allowing for longitudinal analysis over time and identification for sensitive periods. There's head circumference was measured in childhood, and at age 46, hip and waist circumference and body fat were captured. The medical examinations at age 10, 16 and 14 have captured a range of measurements. So for example, in childhood, you have blood pressure, pulse, vision, audio, I can never say this, vision, hearing, sorry, laterality, coordination and speech. And also in midlife, measures of aging such as maximal grip strength and leg raise balance. At age 46, as I mentioned earlier, it was a biomedical sweep and blood samples were collected by nurses, and a variety of assays, biomarkers are available. I'm not going to read them out because I won't be able to say half of them. And so also the blood samples were used to extract DNA, which is currently in progress, and as I mentioned, should be available next year. During the same field work, an accelerometer was worn on the thigh, and I'll give you a bit more detail about that later. As well as objective measures, there are parents when the cohort member was a child, and self-assessments of general health, as well as the short form health survey at age 46, which is a 36-item patient reported survey of patient health. There are also self-reported medical conditions, disability and chronic illness across the life course, information on reproductive health in adulthood and midlife, and dental health at age 46. There are also information on family health was collected when the cohort members were children. And finally, the BCS-70 also collects information on health behaviours, which could explain some of the health outcomes or other outcomes, or could be explained by earlier life factors discussed, such as family relations, education and cognition. And these include physical activity, diet, smoking, drinking, drug use, sleep and sexual behaviours. Also, there's information on maternal smoking, drinking during pregnancy, parents smoking, drinking and exercise, and for a subsample of cohort members, their health behaviours during pregnancy, as well as the cohort members' children's smoking, drinking and drug use. There's also mental health data available in the BCS-70. In childhood, the Rutter behaviour scales were measured at 5, 10 and 16, and these are measures of emotional and behavioural difficulties. Also at age 10 and 16, the Connors hyperactivity scales were used, and these two measures were completed by the mother. At age 10, the child development scale, which consisted of the two scales I've already mentioned, Rutter and Connors, along with additional items from the Swansea assessment battery, which was completed by teachers. In adulthood, the malaise inventory measuring psychological distress has been measured 6 times across the life course, and there are other measures of psychological distress such as the GHQ-12 and Kessler. As mentioned, the SF36 was also measured at age 46, which includes a section on general mental health. Also, a measure of well-being was administered at age 42 and 46, and also life satisfaction has been measured 5 times across the adult life course, and some of these measures have also been included in the COVID surveys. Sorry. So moving on to a more eclectic theme, behaviours, attitudes and identity. In childhood, there's the Eyes-Inc personality inventory, which looks at introversion, extroversion and anxiety and being unworried, which was assessed by the teacher. Also at age 10, a measure of social judgment was assessed, as well as a measure of locus of control, self-esteem. In adulthood, self-efficacy has been measured on a number of occasions, and also in the BCS-70, a raft of behaviours were measured at age 16, including risky and antisocial behaviour, bullying and victimisation. In addition, the study collects information on the cohort members' activities and interests from adolescence to midlife. There is information on identity, with regards to religion, class, sexual identity, as well as political leanings and participation, also occupational, leisure, sporting activities and other hobbies, as well as attitudes to school, leaving home, religion, politics, sex equality, marital values and work, to name a few. So I hope that's given you a feel for some of the main content that's available in the BCS-70. There's also a range of data enhancements and innovations in the BCS-70, some of which I've broadly mentioned, to use alongside the main content. And first I'm going to explain the different types of data to inform the next section. So there's a wide range of data available. The data goes through a process of classification based on sensitivity and disclosure, and is grouped into low, moderate and the most sensitive and disclosive data. Most of the main survey data has been classified as low-level sensitivity and disclosure and is licensed under the end user license. And in this scenario, which Morag is going to give you some more information about, your application is authorised directly by the UK Data Service, and you can download directly from there. Other data which is under special licence is moderately disclosive, and the most sensitive data or disclosive is available under secure access licence. So for example, things like linked health data, geographical data, mortality data. And in order to access the secure data, you will need to attend a specialised training course. And there's a link there on the website to go for more information about that. So within the Centre for Longitudinal Studies, there's a substantive ongoing record linkage programme. In the BCS-70, consents were collected over different domains, as I mentioned, health and economic, and so far health records for England and Scotland are available via the UK Data Service secure access. There are user guides outlining the details, and if you want to know more about using linked health administrative data in the cohorts, there is a webinar in December. There's also geographical neighbourhood data available via the UKDS. So geographical identifiers, for example, the electoral wards and output areas are available from age 10 to 46 under secure access licence. Also counties lived in from age 10 to 42 based on digitised 1981 boundary files. And from 1971 to 2011, there's a measure of material deprivation, the Townsend Index of Deprivation. As well as persons per hectare, urban-rural indicators, and score on percentage employed, percentage households, non-home ownership and non-car ownership. So to aid cross-cohort comparisons, work has been conducted on harmonised data sets, including those in the BCS 70 and other British other cohorts. And at the moment, there are harmonised measures of social class, body mass index and mental health, and the child's environment. And you can download these from the UK DES as well. Moving forward, there's ongoing work to harmonise across the cohorts in other areas. So this resource is building over time. As Morag mentioned, there's cohort data available from the COVID-19 surveys, which were conducted in 3 waves. So for the BCS 70, in wave 1, where which was during the first national lockdown, there's just over 4,000 responses to that. And at wave 3, for example, there were 5,500 in the BCS 70. As well as online surveys, participants who took part in the COVID surveys were invited to provide blood samples. Around 6,500 were invited and 2,500 returned samples. And there are 2 antibody tests that were conducted, the NSA, which is more likely to identify natural occurring antibodies through exposure to virus, and the SSA, which is more likely to identify antibodies occurring following vaccination. And this again can be downloaded directly from the UK DS. As I mentioned, also at age 46, the cohort members wore an accelerometer on their thigh for 7 days. It measured body posture, i.e. sitting, lying and upright, and transitions between these postures, stepping and stepping speed. And it was designed specifically to produce accurate measures of sedentary behaviour. About 6,500 consented to wear the accelerometer, about 5,500 returned usable data for at least 1 day, and 3,600 plus for the full week. And if you're interested in that, there are more details in the accelerometer user guide. Also at age 46, the cohort members completed the Oxford WebQ, an online diet questionnaire, which included an inventory of food and drink consumed on the previous day of completion, and then completed it 2 days in 7 following a home visit. And this gives you nutrient intake, which was calculated, for example, energy, protein, total fat, etc. And it allows for detailed exploration of the role of diet in determining an individual's health in midlife. And also just to show you that the cohort members, when they're age 16, they also completed a dietary diary. And you can look at dietary food groups and nutrients in adolescence and how this may have impacted on later life. As I mentioned earlier, also the parent and child survey at age 34 was conducted, and the parents were also asked age-specific questions on the child's development, relationships, behaviour, discipline, among many other things. As I mentioned, the children completed cognitive tests, but they also, children aged 10 to 16, answered questions on their leisure time, relationships, attitudes, aspirations, crime, self-esteem, and more information can be found in the user guide on this. Again, there was a similar survey conducted in the National Child Development Study. As already highlighted, there was a twin survey in 2008, which was also conducted in the National Child Development Study, and here 3 measures were developed to look at identical twins, and although it was identified at birth, quite often this can be underestimated. So there was a self-report measure, there was a measure based on 5 standardised questions, asking whether others can tell the cohort member apart, and also on physical similarity. And of the 202 twins, depending on the measure, around 25 to 35% of the twins were deemed identical. Now, moving on to something completely different, onto methodology. I'm now going to quickly look at dealing with attrition in the BCS 70. There are two types of non-response. There's unit or sweep and item, i.e. not answering a question or a number of questions. Item non-response is when the reporter chooses not to answer some questions. And when we look at types of unit non-response, these are those people who have been selected to participate but are not contactable. They've refused, they're unable to, or they're out of scope or ineligible. And in longitudinal studies, attrition is a fact. It's going to happen regardless of any procedures to minimise it, and it's on the increase in all longitudinal studies over time. Unit non-response, it might not be permanent, so you have to obviously be aware that people might come back into the study if they've not completed an earlier sweep. But non-response, attrition, it does have important implications that we need to account for. Now, when you deal with unit, there are different ways of dealing with non-response in the BCS 70 and any study really. You could ignore it. And this is okay if your data is missing completely at random, but actually in most cases that's not likely. If the cohort members are missing on any variable in your data set, the cohort member will be deleted, and this, although straightforward, doesn't deal with non-response bias. So one way to deal with this is to adjust the sample composition to take account of the loss of particular types of respondents by using non-response weights. You can also use other more advanced methods such as full information maximum likelihood or multiple imputation, which involves the generation of multiple copies of the data set, in each of which missing values are replaced by imputed values sampled from their posterior predictive distribution given the observed. Now, in the BCS 70, there aren't actually any attrition weights in the BCS 70 dataset, although there are weights for available for the cohort studies, the BCS 70 cohort COVID surveys. However, a cohort-specific missing data guide will be available next year for the BCS 70. But in the meantime, there are examples which are very relevant that you can follow on how to deal with attrition. So, for example, there is a handling missing data in the National Child Development Study, which can be used to advise and follows through inverse probability weighting and how to use multiple imputation, which you can then apply to the BCS 70. And also a couple of papers which are really useful. The first at the bottom of the slide refers to the National Child Development Study, and then the second is a data-driven approach to understanding and handling non-response in the next steps. But the same principles will apply for the BCS 70. So I'm now going to pass you over to Morag, who will cover data access and some of the resources available to you.
Thanks very much, Vanessa, for taking us through a very complex resource so clearly. I can see that we're getting lots of questions. Please keep posting them and we'll come to those in the live panel chat in just a few moments' time. Hopefully you can see my slides and not my notes, is that right? Thank you. Okay, so this is really some additional resources and how to access the data. So Vanessa, while talking through many of the substantive data points in the BCS, highlighted some of the resources already, but I just want to show you a sort of starting point for finding help using this massive and amazing resource and also getting started. I can see some people in the chat are asking about specific variables, so I'll help. We can try and answer those in the panel, but I'll also help point you to ways to find out that answer yourself should you need to. So the first and probably most sensible port of call is this website. This is the CLS BCS webpage, which includes an overview of the study. It highlights the study features, some latest news and findings, and you can also access the various guides and reports, documentation and documentation dictionaries available for you under popular documentation. So under popular documentation, you'll see things like this, which include some of the relevant user guides. There are specific survey user guides for each sweep of the data. There are also technical reports and guides to derived variables, as well as specific guides for things such as the linked administrative data. In this case, the screen grab is from the BCS link to the HES data, the hospital episode statistics data. So that main CLS webpage, the study page for British Cohort Study, will be a useful starting point for it. And on there, and in combination with what's available on the UKDS, you can find these available resources. So user guides, which have an overview of the measures and more information on response, weights if appropriate, and then other things like the questionnaires, which are a really useful way of checking the exact question wording, which you'll likely need for your data section. Also a way to check for questionnaire routing and the specific variable names that might allow you to identify that variable in the actual data set. There are also, as I mentioned, the data documentation, things like data notes, coding frames, variable lists, and the derived variables and the manner in which they're derived. There are also technical reports outlining the fieldwork, sampling, coding and editing, as well as the data dictionaries that are part of the download that you will get from the UK data service when you're downloading the data. But I would also recommend, as we sort of modelled throughout this webinar, looking at previous journal publications for the data variables of interest, and also you can search obviously within the data set itself once you have downloaded it. Another resource that might be useful whilst thinking about sort of project and research planning is Closer Discovery. This is an organisation very close to the Centre for Longitudinal Studies that has brought together the content of many, not just the CLS longitudinal studies, but many of the cohort and longitudinal studies that we have in the UK. This is a screen grab of Closer Discovery, and you can see that the search term we've put in there is for blood pressure. We've selected that we're interested only in either questions with that term or the variables with that term. And in this case, we've selected by study. So we've only highlighted the BCS 70 study, but you might keep all of the cohorts. You might select all of the cohorts to see which data sets have information on blood pressure. So you can see it comes up with this highlighted terms. We've got 32 within BCS 70. And it'll tell you which age. So we've got 2 variables at age 10 and 1 variable at age 16. And then you can click on that and get more information about that variable. So it's quite a useful starting point to sort of sense check whether things are viable, how things are measured, and is a useful resource, both in addition to the methods I've already highlighted based on the CLS website and the study pages, the documentation, the data itself, and previous journals. So to actually get a hold of the data, you need to go to this ESRC funded resource, the UK Data Service, or UKDS. The data is freely available to researchers, government analysts and third sector workers, and it's relatively straightforward to register and download the end user license data. As Vanessa mentioned, it's more complex as the data becomes more secure and possibly disclosive, where you might need to go through some training or agree to some special conditions. So this is the landing page of the UKDS, and you can see that there's a search box inviting you to search the data catalogue, where you might type in British Cohort Study 1970 and see what comes up. So if I just demonstrate what will come up are screens like these, which include the available resources. So the documentation under the age 46 sweep will include the derived variable user guide, the survey user guide, the variable lookup table, citation file, data dictionaries, and other sources of information. And just to flag, on the right-hand panel, there is the response data set, which is a longitudinal data set that will allow you to document the response for each sweep, which is important for doing some longitudinal analyses. The other, this screen grab is also from the UKDS, and it just shows you how you view the BCS groupings of data. So we have grouped them by survey and biomeasures. We've grouped them by linked admin data and grouped them by geographical data. So this might be an alternative way to search for through the resources on the UK data service for the BCS. And let's say we click on that first one, the survey and biomeasures data. You'll see that within that there are options in different files which have different serial numbers. So it will allow you to sort of identify the file that is of importance to you. And the Nestar is a software, a web software that will allow you to explore the variables online. So you can check that that's the correct file that you need for your analysis. And then you can just select it and download it, add it to your basket. So just to sort of summarise the way to access the data, you first need to register and set up an account at the UK Data Service. Again, it's straightforward for those doing third sector university or non-profit work. And you're just asked to agree that your work is not going to have any commercial benefit. You can search for the data using the Find the Data tab, and then before downloading the data, you would need to just click on Request Access and then Complete Actions. You need to agree to the standard end user license terms and any extra conditions should it be special license. If it's a secure license, as Vanessa mentioned, you would need to do some specific training, so you can follow the link via the UKDS to do that was shown on an earlier slide. Then you simply need to choose the data format and download the zip file, which will come not only with the data, but also those additional documents that we flagged up, including sort of derived variable user guide and the study user guide or the sweep user guide. So hopefully that's clear and inspiring you to get started. Just to sort of plant the seed for the future, thinking about further ahead, we're actually in the field currently for the age 51. I'm not sure if we're now calling it age 52 because there have been some slight delays due to the COVID-19 pandemic, but we're currently in the field with a 75-minute face-to-face interview with participants. We're continuing with an online diet questionnaire, and there will be some paper self-completion for some of the more sensitive questions. And we will hope to have that data deposited at the UKDS sometime next year. The kind of range and content are things that will hopefully be familiar to you now. So following on that longitudinal measures of some of the themes highlighted by Vanessa within the data. So measures on employment and income as they age, things like pensions might become more salient. So we've included more measures of those. Physical health and health behaviours, cognitive skills and processes, mental health and well-being, family and relationships, and those activities, attitudes and values questions, many of which will be continued where possible throughout the live course. So just drawing the sort of presentation aspect to a close, just want to summarise what we've covered and then open up to the panel to answer your questions. So we give you a brief overview of CLS and the BCS before going into a bit more detail to hopefully inspire you on the types of research that has already been done using this data resource and get you thinking about the sort of research questions you might be able to answer. We explored the data by themes, so looking at some of the specific measures under those general themes. And again, that wasn't exhaustive, but just gives you a hint of what's there. And now hopefully you have the tools to be able to search for specific variables yourselves. Vanessa took you through detailed enhancements and innovations of the study. And then I just highlighted the resources available to help you and how to access the data. So I'm going to just go to the panel and ask them to turn their cameras on. So we have George Plebidis, who's the PI, the director of the British Cohort Study, Matt Brown, the senior survey manager, Andrew Peters, the research data manager, and Sam Parsons, the research fellow, as well as Vanessa and I will act as chair because I am definitely not any of the experts on this one. So thank you. I'll move to the questions, just going through them in order. So question about, is there a specific reason for each of the sweep points? They vary between the various measures. So the timing and the nature of the sweeps. Who would like to answer that? Matt, George?
Sure, I can answer that. George,
Great.
You can feel free to chip in. I think there are a number of factors which have affected the decisions as to the timing of the sweeps. One is well, particularly during childhood, the sweeps were timed to take place at key development points for the cohort. So that's one important factor. Funding has been a key factor, absolutely. So you'll have noticed that there was a considerable gap in particular between the age 16 survey in 1986 and then the age 26 survey in 1996. And obviously that gap was not planned. And that gap resulted from difficulties in securing funding during that period. But fortunately, since then, the funding for the study has been a lot more secure. So from 1996 onwards, pretty much, we've been able to run the study, run major sweeps of data collection every 4 years. There was just a slight delay to that plan caused by the COVID pandemic most recently. And then the other factor which we try to take into account when planning the timing of the data collections is to ensure that we are harmonised across the cohorts as much as possible. So we've been guided quite significantly by the timing points when data has been collected in the 1958 cohort and the 1946 cohort, so that we can try to ensure that the data that we collect facilitates cross-cohort comparisons when participants are at the same age.
Thanks. George, anything to add, or are you happy? Yeah, okay, this one might be for you then, or a more general question. What findings or trends from the study have we felt has been most significant to us and the team?
Thank you, Morgan. I think it's a very interesting and important question, right? I think I will give some examples. I think with such a rich study at BCS70, there are many, many findings and across the years, right? So, and as things change, science changes, we have more knowledge and so on. But in terms of the word trends, right? I think some interesting, important trends. I will give an example of mental health. So, for example, in BCS70 was one of the studies that we have showcased that, for example, midlife is a period of life where there is a peak or elevated psychological distress. BCS70 compared to the 1958 British Cohort, the 1946, they appear to have more psychological distress and lower life satisfaction around midlife. So that's an interesting trend because it was, let's say, when we first observed this, it wasn't what we were expecting. BCS70 has been also been used to showcase the impact of the obesity epidemic. And again, BCS70 compared to previous born cohorts, it has higher rates of overweight and obesity. The example that Vanessa mentioned, that the multimorbidity example that 1 in 3 participants in midlife had one or more chronic illnesses, which again was a bit of a surprising finding. We weren't expecting something so prevalent as 1 in 3, like 33%. So this is in terms of health trends, right? Of course, there is a lot of work on social mobility. Again, the paper on mobility in income-based social mobility, the paper that Vanessa mentioned, and how much of this is explained by early life factors, that 50%, that was, I think, an important finding. And another one that comes to mind from a bit of a slightly different kind of discipline is that parental investment, right? There's been evidence in BCS70 that parental investment can lead to resilience. For example, one of the major findings, not only from BCS70, but other cohorts as well, is that early life socioeconomic disadvantage can have a long-term impact later on in life, impacting on various outcomes, health, social, economic, and so on. It hasn't been shown that parental investment, parents reading to their children, for example, can mitigate some of this adverse impact. And so on. So these are just some that come to mind. There are many, many others, right? This is just me, and I'm sure others in the panel will have other kind of other examples and so on. But these are, BCS70 as the other cohorts, of course, are very, very, very rich studies with hundreds of papers being published every year and a lot of policy impact. So yeah, these are just some examples.
Thanks, George. That's helpful. I won't ask the panel because we might be here all day, but we can have a think about those favourite ones of all time. Okay, next question. Do the 3 other cohorts cover similar information? For example, family formation, assessments, physical health, etc. And I can answer yes, we will share the slides after the session, but does anybody want to answer that one? Similar? Yeah.
Well, yes is the answer to that question, pretty much. Yeah, we obviously are, very mindful, as I was saying earlier, with regard to the time points, in order to facilitate cross-cohort comparisons. It's not just about having the data collected at the same time points, but also ensuring that as far as possible, the questions that we asked are harmonised across the studies. And so, yeah, the cohorts that we run do all cover very similar, very similar topics. In particular, NCDS and BCS70 are very closely aligned, and some of the sweeps have actually been carried out in combination, and that's something that we might plan to do again in future as well.
Great, yeah, and just to say, Next Steps is slightly different because its origins were an educational study, but we are moving to a more sort of holistic measure of life. So while it lacks some of the early life stuff and some of the physical health stuff, we're trying to do a bit better in collecting that in mid-adulthood. Okay, I'm conscious a bit of time. Next one, regarding mental health and well-being, do you also collect data on mental disorder diagnosis based on structured clinical interview? Vanessa, George? No, yeah, George?
Vanessa, I'm happy, very quickly to say, well, within BCS70, no, we don't have like something like a very structured clinical interview to get diagnosed, but we also have, let's say, mental health measures that capture, let's say, population variation and things like psychological distress, well-being, and so on. In one of our other cohorts, the 958 cohort, we do have one of those interviews in one of the sweeps, but it is something that we don't generally do because they take a lot of time, for example. And also, I think population mental health variation is much better captured with more generic scales that don't result in a particular cutoff point of caseness, or, well, let's call it diagnosed, although, you know, it might be not exactly diagnosed and so on.
We in addition to the mental health and well-being scales that we cover in BCS70, we do have some additional questions which do ask participants about whether they've experienced particular mental health conditions and whether these have been diagnosed by doctors, etc. So it's not a structured clinical interview, but we do have those additional measures in addition to the kind of in addition to the mental health scales that we ask.
Okay, thank you. So the next one is a bit of a test of our own databases in our brains, and we may not be able to answer this, but hopefully now you would know how to search for this on Closer Discovery or through the questionnaires or the data itself. Has there been any data collected in any time point about exposure to violence perpetrated by a family or non-family member for cohort members and or for their children? Does that ring a bell for anyone? Sam, oh, sorry.
Sorry, Sam, go for it. I was just going to say that in the age 50 survey, which is currently in the field, we are definitely collecting information about experience of domestic violence.
And I don't actually know about BCS70, but it is included in MCS for both main and the partner interviews to ask if their partner has been violent or used force against them.
The cohort member or the parents? The parents of MCS cohort members,
Yeah, in BCS70, I'm fairly sure that these questions that we're asking at age 50 are the first time that we've asked about experience of domestic violence.
Yeah, but again, hopefully you're able to search for variables now that you have seen the tools that you can do so with. Any tracking of attitudes towards race, and a related one among political attitude questions, are there any questions about immigration attitudes or interaction with immigrants? So again, this is a bit of a test of your own memory. Sam, Matt?
There are. There are. I think in BCS, the mother is asked when the child is age 10, there's some questions. And about attitudes to neighbours, and then I think at age 30, if I'm not mistaken, Matt, I think there's some questions there.
Yeah, well, there's a set of attitude questions related to various domains, of which race is one of them, which have been repeated in various surveys throughout BCS70. So there has definitely been some tracking of attitudes towards race over time. And on the second point about immigration, there's a new set of questions about attitudes towards immigration in the current age 50 survey as well.
Okay, thank you. So this is a three-parter. What are the other similar UK data sources? I guess outside the Centre for Longitudinal Studies, the 4 that we hold here, and then the ones that are in development or in collaboration. I guess we could shout out names. There's, I guess, do you mean longitudinal studies? If so, ALSPAC. There's
Understanding Society.
Yeah, Understanding Society, previously known as the British Household Panel Study. George?
The 1946 British Birth Cohort that we of course very closely collaborate with, which is also
there's
BCL.
There's the ELSA study, the English Longitudinal Study of Aging.
Yeah. Born in Bradford, which is another study specific in Bradford, like ALSPAC is in Avon and so on.
Generation Scotland.
Yes, Generation Scotland, absolutely.
Growing up in Ireland, I suppose that's not UK, is it? That's Southern Ireland. There are loads. We're great at data,
yes.
But the UK data service is a useful starting point to sort of see the scope. But the next part of this question: are the results of other data collections often used in conjunction with BCS 70 for research? George, please. Yeah.
So certainly, I think the cohorts, you have papers, focused on a particular cohort, a particular generation, right? And there are many of those, but recently, more and more, you have multi-cohort papers, either papers that are comparing a particular outcome in various generations. I gave some examples previously on mental health and obesity, or there are others. Or, for example, within the pandemic, right? Within the National Core Studies, that was an initiative by Sir Patrick Vallance and Chris Whitty, bring together various cohort studies to answer particular questions on related to the pandemic, for example, the social, economic, and health impacts of the pandemic. BCS 70 was included along other cohorts in various papers. So I think Vanessa had one example there on the furlough scheme, for example, in mental health and so, but there are many papers where BCS 70 is used either in conjunctions with the cohorts within CLS, but also the studies we mentioned before, other studies, including the ELSA, the 46 cohort, ALSPAC, Understanding Society, and so on. And I think this multi-cohort paradigm, let's say, will be used more and more in the future, especially for specific research questions.
Yeah, great. And this last part, have participants been approached by Biobank to boost the results? I guess I'm struggling to picture what that might mean to boost the results, but George, Matt's shaking his head. But
no, I think
I'm not sure what the question was getting at there.
Yeah, I think if the question is whether there are participants in both, I don't know, right? Biobank is big, but these two studies are different, right? This 70 is representative of its target population, which is very important for all types of science. That is done. Biobank is a great study, but it's not representative. It has very specific aspects and so on. But I think the answer to that is no, as far as I know. No.
Mm-hmm. Okay, is there someone we can contact if we're struggling to navigate through the multiple data sets? There is a CLS feedback email address that is a general email address that you can email and will be picked up by the data team and then answered by the best person in CLS. It's not that we can offer a sort of supervisory service, but we can certainly help point you in the right direction if you're struggling to navigate through the many data sets. This next question is there a single file or spreadsheet which provides an overview of the measures across data sets, which would be particularly helpful for planning longitudinal analysis? I guess my response, and others might want to chip in, is Closer Discovery is essentially that, but just with a user interface on the front of it. The sweeps can have, up to 6,000 variables or something crazy. So the number, when you add up all of the sweeps and all of the cohort studies, it's a huge task to document and to allow people to search for that. So there's not a single spreadsheet, but Closer Discovery is essentially that resource, as well as, I guess, the data dictionaries in combination would allow you to search for things. Don't know if anybody else wants to add anything to that answer.
Very quickly, Morag, if I
please.
may, that I know that within the current CLS work that we're doing on data discoverability, we will be piloting a data set in all cohorts that includes measures that have been repeated longitudinally. And if that works well, and after piloting, we will make it available. But again, it's piloting, it's not there yet. So that perhaps will be something the closest example to that question. But again, it won't be everything, right? It will be a subsample of things that have been measured over time, and again, we will be piloting this. But as Morag said, those studies are very rich, the scripts are very rich, so the cluster discovery is the best way forward, I think, for now at least.
Okay, I'm going to plug the feedback form again. Richard, if you're happy to put that in the chat. I'm conscious we've got 4 minutes left, and we've got so far 3 more questions. When you mentioned that values were assessed, what was this done with a formal scale, i.e. the Schwartz scale, or more general questions?
Changes are people are being asked to make more active steps.
Sorry, we just asked that I didn't kind of catch that, but we do ask you keep your mics muted. So anybody able to answer this question? Is it a formal scale? I think it's just the Likert scale, is it, for most of them? Agree? Strongly disagrees?
Is this, sorry, I'm not very familiar with that SVAR scale, but if this is a scale that, you know, a formal scale, like a formal, you know, questionnaire of depression, let's say, whatever, I don't think we have the, Matt, correct me, I don't think, for example, the SVARs, if this is a value scale that we have other general questions for values, but not a specific scale, right? A specific questionnaire which is validated to measure values. That's my understanding. Is that right, Matt?
Yeah, I'm not sure if the question is relating to the attitude questions that I mentioned. So, I mean, they've been kind of, they've come from a variety of different sources. Some have said that, yeah, we have had some specific scales that we have included in certain sweeps on values as well. But yeah, all of this, the kind of, all of the scales that we've used are documented in the user guides for each particular sweep. So I think those are where I'd recommend, those documents are the sort of best place to look at for particular details about scales that we've used.
Okay, at age 16, the study members were asked to make dietary diaries. Will we see these in the future sweeps?
So we as Vanessa mentioned, we did include a dietary diary in the age 46 survey, and we're repeating that in the current age 50 survey. Whether that will be something that we continue in every sweep going forward, I'm not sure I can say at the moment, but there's certainly going to be dietary data available from the age 50 survey.
And then the final question, are there any courses or training on longitudinal studies foundation? So for example, methods for sampling and weighting participants. I guess there's a master's programme, there's plans for some short courses, there's plans within our training programme to start to include some more methodological things across next year. But I would say keep an eye on the CLS training and support webpage, and then it's hard to say, it's implicit in this question for free, I guess. A lot of the courses will be master's programmes that would specifically look at these.